Meet Betty. Betty is a 78-year-old female. She has come to the doctor complaining of having right knee pain after a recent tumble where she fell and scraped her arm. The doctor asked Betty to describe her symptoms. She said her knee had been hurting for the last week whenever she moved it. She also complained that the area was swollen, red, and hot. She was putting ice on it, but that caused her to get chills, and she felt as though she had a fever. Sometimes she even felt her heart was going to beat out of her chest, and she was extremely fatigued. The doctor was initially puzzled as to why her knee was hurting when she had fallen on her arm. He decided to order some x-rays to see if something had broken in the fall. The x-rays did not show a fracture, however, they did show that she had some form of arthritis. Narrowing down the exact type was the next step. The doctor then sent her to MRI to get a scan of her knee. MRI is extremely useful when diagnosing certain types of arthritis, as they show better soft tissue detail than an x-ray would. The MRI results confirmed that Betty had arthritis, and the doctor was pretty sure that Betty had a form called infectious arthritis. To be sure, he sent her to have a joint aspiration to drain the fluid from her knee. The fluid was then sent off to the lab for gram stains, cultures, and cellular analysis. Joint aspirations are often fluoroscopy guided. Unfortunately, the results came back to confirm the doctor's suspicions. Betty indeed had infectious arthritis, and this case now became a medical emergency. Infectious arthritis is a type of arthritis that is caused by a purulent invasion of a joint by an infectious agent. Infectious arthritis is considered a medical emergency because the pyogenic organism that causes pus to accumulate in the joint space doesn't just inhibit function and cause pain. If left untreated, the organism and the pus created can permanently damage the joint by creating enough pressure to cause necrosis. The doctor broke the news to Betty and told her she did have infectious arthritis that needed to be treated immediately. Betty was shocked, and all she could say was, "How in the world did this happen? What caused this?" The doctor told her it's typically caused by a bacterial infection, Staphylococcus aureus or Streptococcus, which invades the body at a separate point and moves through the bloodstream and penetrates the synovial membrane of the joint. However, the same series of events can happen with other organisms, such as mycobacteria, viruses, and fungi. The doctor knew that she hadn't had a knee replacement, which can cause this kind of infection. He concluded that when she fell, the infection from the wound on her arm traveled through her bloodstream and affected the joint of her right knee. "What now?" she asked. The doctor told Betty that he would be starting her on a round of antibiotics immediately and giving her an analgesic to reduce the swelling and pain. If the first round of treatment was unsuccessful, they would try another joint aspiration, followed by a more aggressive round of antibiotics. A worried Betty asked about her prognosis. The doctor told her that they should be able to successfully treat the infection. However, they prefer to treat people within 48 hours of the onset of these symptoms, and Betty had waited a week. As a result, there could be some possible permanent joint damage or even osteoarthritis. Betty went to the pharmacy straight away, determined to beat the infection and get back to her silver sneaker workouts.